Hi, my name is James Bogert, and I'll be reviewing the East landmark paper regarding intraoperative versus preoperative evaluation of the common bile duct in patients suspected of having choledocholithiasis. Choledocholithiasis is present in 5 to 15% of patients with cholelithiasis. Most patients are asymptomatic, and controversy does exist on proper management of patients with suspected choledocholithiasis. There is the option of immediate laparoscopic cholecystectomy with intraoperative cholangiography versus preoperative MRCP to evaluate the common bile duct versus preoperative ERCP to evaluate and potentially clear the common bile duct. The purpose of this study was to evaluate these three strategies and their effect on length of stay of patients with choledocholithiasis, as well as evaluate the usefulness of MRCP in this setting. To do this, the authors conducted a retrospective review of 2 hospitals' charts. Patients were included if they were adults and they had suspicion of choledocholithiasis, defined as a dilated common bile duct on imaging, elevated bilirubin, or an imaging study showing choledocholithiasis. Exclusion included pancreatitis and cholangitis. The authors found that the 3 groups varied significantly with regards to age, their ASA score, their preoperative bilirubin, and their common bile duct size. The length of stay was significantly shorter in patients undergoing immediate laparoscopic cholecystectomy with intraoperative cholangiography. Looking more closely at these results, a laparoscopic cholecystectomy with a negative IOC had the shortest length of stay of 2.93 days. If the IOC was positive, that length of stay increased to 4.82 days, which is still much less than the 6 and 7 days respectively of preoperative MRCP and preoperative ERCP. In the setting of a positive IOC, if the strategy was to perform a post-op ERCP, the length of stay was 5.09 days, whereas in patients where a laparoscopic common bile duct exploration was attempted, the length of stay was on average 4.29 days. MRCP that was able to find choledocholithiasis was associated with a length of stay of 8.13 days. The authors concluded that in order to decrease length of stay, patients should be offered an initial laparoscopic cholecystectomy with IOC. If the IOC is positive, a laparoscopic common bile duct exploration should be attempted, and postoperative ERCP should be performed if the laparoscopic common bile duct exploration was unable to clear the common bile duct. The authors concluded that MRCP is not recommended in the setting of suspected choledocholithiasis. Thank you for your time.